No.
All right, perfect. Okay, so let's give a few seconds for everyone to pop on.
This one is too. See how that one is looking?
Is this one
Maybe
a
put
little
it
bit?
back a little bit.
I just can't read the questions.
Oh, okay.
Hello, hello. How's everyone doing? Happy Friday. Lauren says I'm ready for my round 2. Look at that. Okay, perfect.
Hi there, everybody.
Comments are rolling in. Hello, hello. How are you guys doing?
I'm cut off over there. See, I don't know what to do. Bring it a little bit.
Oh.
Yeah, try that. Okay.
That looks better.
Hi there, everybody. I hope you can see us well. All right, so we're ready for the weekend. But before we go home, let's answer some questions and see our fans here live and see what you guys want to know. Anything we can explain. So go ahead. She's going to read the questions to me, and we'll try to make them as brief as possible and good, easy, concise answers.
Perfect, perfect. So as you guys heard, if you guys have any questions, concerns, doubts, go ahead and leave them in the comments section. I know I saw one there saying, "I love your work, Dr. Ghurani." So
Thank you.
Already.
Thank you. I can't see the small writing, but Carolina's gonna read them.
Yes. Okay. So we have a question here on TikTok. Nails by CJ. Hello. What is your BMI requirement?
Okay, guys. So the BMI requirement is set by the Department of Health here in Florida to be limited to 40 BMI. I'm not a very big fan of the BMI, but we have to adhere to the number 40, so it has to be 40 and below. BMI, as you know very well, real briefly, is a very gross estimation, all right? So it's weight, and the weight is not really divided into fat, muscle, and fluid, so I don't like that. But personally, I like to see pictures to see the distribution of the fat. So please send us the pictures and we'll see how we can work together to get you on the table here and get the procedure that you want. But measure your BMI, be honest with your height and weight, and if you have to lose a little bit of weight, we to try to see if we can fit you into the below 40.
Awesome, awesome. So how do you guys do that? Go ahead and send your full name and number for a free consultation with Dr. Ghurani. So go ahead and do that here in the comment section in the DMs, all right? So we have a few more questions popping in.
Go for it.
What vitamins should we take prior to our surgery?
Okay, I recommend that everybody, even if your blood count is good and your numbers are good, multivitamin. Focus on vitamin C for sure. It helps with healing. Folate, vitamin B12, and take some iron supplements, because regardless of how good your surgeon is and the time we take to do the proper procedure, patients do lose some blood during the liposuction in particular. So if you can take some iron to boost your hemoglobin, it'll be a good idea, and that's before and after.
Awesome. Speaking on that, there's a very good supplement that we recommend called Floridix. Super good for your hemoglobin levels, so all of that. Perfect. Okay, so we have, is 38 too old for a BBL?
No. It doesn't. Age is not the number that I look at. I look at your overall. I look at the pictures to see how your skin looks. I look at your health history, your past medical history, what procedures you've had done before, and any medical problems. So I put that together and assess your risk. But no, 38 is not an old age by any means.
Perfect. Okay. So you guys are asking about the prices as well. TikTok and social media is a little iffy right now. So go ahead and send us your full name and number, and then of course we can discuss that with you further.
So there are some specials going on before the end of the year, but the best way to do this is to let the patient care coordinator explain it to you. I think this platform here right now, it'll be easier for us to answer concerns that are surgical questions that are more pertaining to the surgeries themselves. But you're not going to be disappointed with the prices, so please go ahead and leave us your information, name, number, email, address, and a phone number, and a trained professional will call you, and all the pictures come back to me. I see everything from pictures to medical history, and I'm the one that actually gives them the okay to proceed.
Awesome. Thank you so much. Mashera says, can you please answer my question? I am so sorry. Sometimes
Sure.
TikTok filters out the questions so we don't get them. If you could please send it again and maybe type it differently so TikTok doesn't flag them. And then, of course, we would do that for you. I am Kimberly is asking how much buccal fat removed. Go ahead and send us your DM.
The buccal fat is anywhere from 3 to 5 cc's. It's just the location where that fat pad is in this area of the cheek does help create that hollow feeling and improve the contour right under the cheekbone.
Okay, perfect. All right, so we have a few more questions here. I've been following you for a while and I want to book with you, but I'm wondering if my anxiety may get in the way. Do you deal with patients with this kind of issue?
Okay, almost everybody that comes to surgery, especially the ones that have never had surgery before, have a certain amount of anxiety. Obviously, we'll talk to you. We'll try to do it by explaining things as clearly as possible, answer all your questions so that you can feel comfortable. The best way to deal with this is to know that you're coming to a place where you're having surgery with a board-certified plastic surgeon that has a lot of experience and good foundational experience based on good training and consistent results, and in the intention to do well but by my patients. I don't try to do anything that is that will compromise you. We have a state-of-the-art facility, equipment that is up to the standard of care, and I only work with anesthesia professionals that are very well trained. We have good equipment, so the OR in our facility is just like an OR at the hospital. I think that we do things a lot more efficiently here. We don't have a lot of waste. We are it's a clean facility. We are very up on our sterilization techniques, and everybody in the OR is trained in their prior careers in hospitals. So it's a very efficient, very well run, well-oiled machine. Any further questions based on your procedure itself, I'll be more than happy to discuss them. Either you ask questions to my coordinator, she can ask me the questions, and sometimes if time permits, we can do some virtual consultations. Usually when patients meet me in person, I feel comfortable that I put pretty much everybody at ease. All right, so I listen to my patients, and whatever the question is, there's no silly questions. Please ask them. The silly question is the one that you never asked.
Of course, very good. Okay, so we have here, Mashera says, I'm 10 weeks tummy tuck post-op. Is it normal to still have a hard stomach?
Yes, so you're swollen, and swelling, when you do such extensive procedures like liposuction and tummy tucks, the swelling is in a very large surface area, and it takes time for all the tissue to heal, and then the drainage system of the body and to reconstitute, and for it to efficiently get all the fluid to be removed. So I recommend that if you're 10 weeks after surgery, consider wearing the garment, considering going to a massage therapist and getting some lymphatic drainage massages to assist your skin in healing.
Awesome. I saw a question here that I liked. It says, if I don't have any fat to transfer for BBL, can it still be done?
Okay, so that really, give me the opportunity to see your pictures, because I will be able to point out areas where you're storing fat. Unless you're like a sprinter or a professional soccer player that burns calories like crazy, we will be able to find fat somewhere. Usually the fat deposits are the lower abdomen, the love handles, the back behind your waist, bra line, inner thighs. When lipo is done in the love handle area, your shape becomes more obvious. You have a narrower waist. You're not hiding those dimensions. And then even if it's not a large volume, just the fact that we're changing the ratio, narrowing your waist, cleaning your flanks, and then adding whatever we can get to your buttocks in strategic places, that makes all the difference. It's not how much you dump into the buttocks that makes makes a good case. It's where you take things out strategically. So give me your pictures and I'll be able to comment on that.
Very good. Awesome. Thank you. I know you guys are asking for prices there, but like Dr. Ghurani said, we have amazing deals right now. Due to social media, I can't really tell them, but go ahead and book your free consultation, and the coordinator will contact you and definitely give you a quote.
And you can DM me on Ghurani MD. I monitor my own Instagram, so I'll send your information over to the coordinator, and they'll reach you as soon as today or Monday.
Awesome. Thank you. Okay, so we have Chocolate Goddess 444 says, can you get a BBL if you have hidradenitis suppurativa?
Okay, so that's a condition where you get sweat glands that get infected and they create tunnels under the skin. Okay, so it depends where they are. So and I urge you to go to your general surgeon and your dermatologist and get treated. And one best way of getting rid of them is to actually remove them. When I was working at the university, we had a few cases like that where we had to remove the area that was always causing infections. Now, if that area is close to the buttocks, then and it's actively infected, then yeah, we kind of try to stay away from aggravating that area and causing a full blown out infection. So again, on an individual cases, please let me know where that area of the hidradenitis suppurativa is, and we'll work with you as best as we can. And I'll be honest with you if I feel like it's something that will put you at risk.
Awesome. She actually just responded. She says, yes, I'm currently taking injections to get rid of it.
Okay, and if you can let us know where the spots that are, because everybody's different. Some people get it in the armpits, some people in the groin, under the breast. So be specific where it is, because those are areas that we would try to avoid completely, so that we do not contaminate the fat or cause further infections. Because what you see at the skin does not tell you the whole story. There's tunnels that go deeper. So anyway, not to belabor the topic, DM us and I'll be more than happy to look at your pictures and give you feedback.
Awesome, great, thank you so much. Okay, so Sprinkles here is asking, does a BBL round 2 hurt more than the first one?
Everybody's different. I see patients walking in the next morning with full makeup and ready to get their massages, and then I see patients walking in the next day like they got run over by an 18-wheeler. All I can tell you is everybody is taken care of with the high standard, very good technique that I use, and we give you guys good pain control while you're sleeping under anesthesia, and we give you medication to go home with. We try to help you with post-operative pain. So again, it's kind of all over the spectrum, so we'll honestly, it kind of, based on your past experience, I don't foresee it being that much of an issue if the lipo is done well. But again, pain control, post-operative pain management is something that we take very seriously.
Awesome, thank you. All right, Kita Boo is asking, how much time does it take to return to work?
With a BBL, depends what you do, but you really need at least 2 weeks off, at least, to be able to kind of get over that acute phase where you're draining a lot of fluid, you need help. That I ask you guys not to sit down or sleep on your sides for the first 4 to 6 weeks. So, if your work requires you to sit down, then that's an issue. You might have to get yourself a height adjustable desk and work standing. I understand everybody has to make a living. It's a little bit of sacrifice, this procedure, but at least 2 weeks off.
Awesome, thank you. Okay, so I am Kimberly is here asking, is there a list of recovery supplies we can obtain somewhere in preparation?
For sure. So when you call us and you start an evaluation, we will supply you with a lot of feedback. We will give you emails. The emails have a lot of information for you to get prepared. Yes.
Perfect. All right, Dove Shonda is asking, do you have experience with removing a chromic seroma with pseudo bursa 8 months post-op tummy tuck?
Okay, so a seroma is removed the most efficient way that I know to remove a seroma, if it's failed all the conservative therapy, you try to drain it directly, or you send it to the interventional radiologist to drain under ultrasound and put some like a material in there, liquid in there to cause it to collapse. If all that fails and the lining is so strong that it keeps on forming fluid, it has to be done surgically, where you enter and you remove that capsule completely out and put a drain and let it collapse in worst case scenario. So if that's the issue, please let us know.
Perfect. Okay, so we have Tina here, and then we have Loving Life kind of asking the same question.
Okay, sure.
So if out of the state and interested in a BBL recovery time, how soon can I get on a flight?
Okay, I request that you guys stay here 7 post-operative days. So after surgery, 7 days. okay, so that we can take care of you, get you out of that very rough period immediately after surgery, and also for you to be hydrated well, be able to, make sure that we teach you as much as we can, and then, flying immediately after surgery can put you at a higher risk of getting blood clots. So, please try to pay attention to these details. We really like to have you around so that we can teach you and help you in the acute phase after surgery.
Very good, very good. Awesome. Okay, so she's saying it's rescheduled for April. So excited, super excited for you.
Looking forward to see you.
Awesome. All right. What's the difference between circular and regular tummy tuck?
Okay, circular tummy tuck, I'm gathering from the word, is a tummy tuck that is taking the excess skin all the way around. So basically the skin has been so loose and the patient probably lost a lot of weight, and you have to chase the extra skin all the way around. Again, send me your pictures and I'll be able to give you feedback on that.
Awesome, awesome. Diana Juarez is asking, is it better to do a BBL and a tummy tuck separately?
Yes, absolutely. I don't combine a BBL and a tummy tuck. Absolutely not. I will combine a breast procedure with a tummy tuck. And recently we've incorporated also the Mommy Makeover Plus, which includes a breast procedure, a tummy tuck, and a intimate area procedure, where either a vaginoplasty or a labiaplasty. Those are okay together. But if we have to, if the patient is asking for a breast and tummy and then a BBL, I think that is, in my opinion, and again, just to emphasize my opinion, in my experience, in my fund of knowledge, I think that those two procedures should not be combined. It increases the risk way too much. And again, what are you going to favor? We're going to do lipo 360, put a lot of stress on the skin, then flip you face down and inject fat into your butt. And then what's going to happen to that incision right down here, that smile line incision of the tummy tuck? I think that is too much stress on the skin, and it increases the surgical time way too much. I don't think it's a smart procedure to combine. I'm sorry. I know a lot of people might push back on that. They might choose other surgeons, and God bless them. I wish them all the best, but not under my watch.
Awesome. Thank you for that answer. We have another question here. Hi, can lipo be done to remove fat on top of the buttock?
Yeah, the lower back. I'm assuming that's what you're asking about. Yes, that's part of the lipo 360. You clean up the lower back, the love handles, go up to the bra rolls, so that we can create that hourglass.
Perfect. So Loving Life is asking, what is the best time of the year to get work done?
It's up to you, my dear.
Now.
It's up to you. It's something that depends on your schedule. I occasionally take vacations, and my scheduler knows that. And if it falls in the same time, then you guys will know right when you book at the beginning. So, whenever it's comfortable for you.
Awesome. Okay, Dr. Ghurani, I have stubborn fat around my belly and I'm frustrated with it. Do you recommend any certain procedure?
Okay, so again, without pictures, without some history, it's very difficult to give you an opinion. But what can be done for stubborn fat is liposuction, obviously. And if the stubborn fat is associated with loose skin, then you're going to have one or the other first, and or both. So since I don't combine tummy tucks with BBLs or lipo, the emphasis has to be placed on what is the biggest problem. So if your biggest issue is very loose skin, then we'll address the tummy tuck first, and then we'll come back in 9 months and do a lipo to finish up the case.
Perfect. So Nails by CJ, Dr. Ghurani actually just answered that question, but if you want to repeat yourself, do you do tummy tuck and BBL together?
Okay. Again, I don't. I will not combine a BBL with a tummy tuck. I will combine breast procedures, tummy tucks, and private area rejuvenation like vaginoplasties, labiaplasties. So those 3 procedures, the patient is laying on their back facing the ceiling, so the patient is efficiently done in a nice chronological manner and less risk. When you have to combine a lipo 360 and a tummy tuck, you're increasing the risk of skin damage and skin loss. And then I just don't in my mind, I don't understand how a patient can recover face down after a tummy tuck to protect the fat that's in the buttocks. And I know patients have told me that they make a hole in the chair. I think that is just not ideal. I think it's too risky. And again, this is my opinion, Dr. Ghurani's opinion. I know other surgeons are going to push back, other surgeons offer, but it's been my experience that I get a lot of patients that have gone to other places outside the country, inside the country, to other surgeons that I might even know myself, and they're not really happy with the outcome, because it's either they're not happy with their tummy tuck, or they're not happy with the way the BBL was done, or they're not happy with both, and we're having to do revisions. So my recommendation, if you want a BBL and a tummy tuck, or lipo and a tummy tuck, real lipo, I'm not talking about the limited lipo that we do on the waist during a tummy tuck, a real 360 liposuction of the torso, do it separately. And then send me your pictures, I'll look at it and I'll tell you what I think is your most suitable procedure, and we'll stage them.
Perfect. So
Okay.
guys, send us a DM to book that free consultation, okay? The Mami Barbie is asking, how much does the vaginal plasticity start at? So we were talking about that a little bit earlier. Unfortunately, we can't really give prices because social media.
So I'll help you with that.
Sure.
Yeah. Vaginoplasties, labioplasties, a combination of the two. They're procedures that are really helpful in rejuvenating the female private area. Again, the best thing to do is send us your information, and we will have our pre-op coordinator discuss these procedures with you. More than happy for you to do a virtual consultation if you need to, or in-person consultation. I know it's difficult when it comes to the private areas for pictures. We respect that. So again, we will try our best to work with you, and I will let you communicate with our coordinator, and then that information will go over to my wife, Dr. Giselle Ghurani, who will evaluate all these cases and give her best advice possible. Again, I really encourage coming in if you can. Pictures, I know that that's a difficult topic, but we'll try our best to help you as best as we can.
Awesome. And then about the price, just go ahead and
Yeah,
contact
prices
us.
are, it's not something that we're going to discuss online.
Perfect. Okay, so the one is saying, I had a butt injection 9 years ago, but can I still get a BBL?
Okay, it depends what the butt injection was. So if it's a polymer, go get yourself a CT scan of the abdomen and pelvis so that we can see where that stuff is and what kind of reaction has caused in the fat. If there's a chronic inflammation there, which is associated with permanent material that doesn't go away, the body kind of wraps it around, and it's what I call a hostile environment. If the fat gets close to that area doesn't have good blood supply, and your fat will die, and you can have infections. So my opinion is, best thing to do if you don't know, and your fat will die, and you can have infections. So my opinion is, best thing to do if you don't know what the CT scan of the area, send us the CD or the thumb drives or a password so that we can enter into the images and see your actual images.
Perfect. I liked this one question by Diana Juarez here on TikTok. She's asking, can you do etching with a tummy tuck?
Yes and no. You have to be very careful, because the etching to get that midline indentation that looks very athletic, and the side one, they're in the area that where we actually detach the skin. To a certain extent, yes, and it also really depends on your body habits and how thick that area is. So if you're really overweight, then it's much more difficult, because when you start doing aggressive lipo to do etching, you're also risking the chance of devascularizing or compromising the blood supply. So it's by case.
Awesome. Okay, very good. All right, highest BMI. I know you talked a little bit about this before. I carry my weight in my stomach.
Okay, so we don't like the word BMI, but we have a limit imposed on us by the Department of Health, which is 40 and below. After 40, it cannot be done here. So that, I hope that helps you. When you carry your weight in the middle, some of it is under the skin and some of it is internal. Internal fat is called visceral fat. Visceral fat is fat around your vital organs. That's not something we can touch. Okay, that's the inside fat. Now the fat that you can pinch under the skin, that's what we can remove. And so everybody has a combination of both. And distribution is, like you said, you're saying in your case, it's in the middle. Again, send me pictures and I will be able to tell you how we can help you. But any form of liposuction that we do, and I have the experience with patients that hold their weight in the middle, when they go to sleep and they're more relaxed and we're able to get easily under the skin, everybody is happy at the end, because yes, you might hold a lot of weight inside, but the stuff that we remove from the outside really helps you emotionally look better, gives you a kickstart. And I've seen a lot of my patients that suffer from being overweight and are hypertensive and pre-diabetic. When we give them this type of a lipo and they see the hourglass, they're so motivated that they don't want to waste that, and then they start pushing themselves to eat better. It's really, guys, I mean, I was watching a podcast by a very well-known expert in the field of health and nutrition, and it really the research lately is showing that it's more of what you eat. You know, I know every person is different, and some people react to foods differently, but it's really what you eat. It's a caloric deficit that we have to be in. I'm not saying starvation, and I'm not pushing. I'm not a nutritionist. I'm not a proponent of giving people the semaglutide, all that stuff. I think controlling your food intake really helps. So again, BMI is below 40. I know I kind of went down a different pathway, but send us your pictures, and again, I'll give you an honest opinion.
Awesome. Thank you so much. Carolina here is asking, how long after you take weight loss pills can you have a BBL procedure?
Okay, so the weight loss pills, you need to let me know what they are. We need to make sure those medications have cleared your system, because they do alter your nervous system and affect your blood pressure and so on and so forth. And so let us know what they are, and I'll be able to give you feedback. So people take Adderall for attention deficit disorder. I like to be away from that for at least 3 weeks. The phentermine, all those medications, really want you off of them for at least 3 weeks. There's a few questions nowadays about people are on semaglutide and the other type of GLP inhibitor agonists. So some guidelines are changing, but basically it's based on the fact that somebody that is on a semaglutide can have delayed gastric emptying. That means their stomach is not moving the food as fast as a regular person, and they can vomit and can aspirate. So these are the things that we need to know. So whatever medication that you're taking, please be honest about it. When you took, how long you took it for, when do you plan on stopping it, and we will give you feedback.
Yes, thank you. I know those are super popular right now. So
yeah, no, we need to know for your safety, because that's all that matters is your safety. I know that the result we're going to deliver, but at the end we want you to be safe and healthy. So medications are not benign. You have to, you take it for a reason, but all medications have their side effects. So we need to look at the profile of every medication and how it interacts with our anesthesia, and so that nothing, no adverse effects happen.
Perfect.
Okay?
Thank you. All right. Ty here is asking, I'm so ready. My BMI is okay, but I've had C-sections.
Okay. Well, a lot of my patients have had C-sections, so that is never going to stop us from helping you. Send me pictures, obviously. The area of the C-section sometimes can be stuck down to the muscle, and we'll try our best to fix as much as possible during the liposuction. Try to see if we can free it up so that it can settle back down in a better fashion. If that does not take care of it, then we can always talk about coming back and doing a tummy tuck in that area to get rid of the loose skin and revise the C-section. Sometimes I've seen some C-section scars where there's 3 incisions, one on top of the other. Not sure why. Obviously, sometimes C-sections are done emergently, so they're not concerned about any aesthetic. They're just trying to get down to the baby, and I understand that. So send me your pictures, and I'll give you the best advice possible how we deal with that. But yes, I deal with so many patients that have had hysterectomies and C-sections, and we can work with you.
Awesome. Okay, just really quickly, Diana here is asking what our Instagram is. Do you have your personal Instagram? Do you know
My Instagram is Ghurani MD. Ghurani MD. One word, no spaces.
Perfect. And then, of course, we have our Icon Cosmetic Center. Here is, as you can see it, Icon Cosmetic Center Miami. So that is our Instagram, okay? And then, of course, you'll see all of Dr. Ghurani's results there as well. All right, what percentage of fat is expected to be retained after healing?
You're talking about the transfer, I'm assuming. So the studies show that about 70% is retained. And then the next question would be possibly, why don't you do a little bit more, like add 130% more? And a quick explanation about that, because I feel it's important. The space between the skin and above the muscle, the area that we're allowed to put fat in there safely, has a certain amount of stretch, and it's different for every patient. There's the deeper fat layer, and then there's a little bit more superficial fat layer, and I use both those areas to take advantage and create projection and fill up the hip dip like everybody asks. But everybody's skin is different and allows us a certain amount of stretch, and after that the skin will stop me. The skin is not stretchable forever like an elastic band. So to answer the question, yes, we expect loss of about 30%, but I've seen a variety of feedback from patients that they've lost more than they thought. And what I try to do is I don't try to dump fat in just one place. I try to continuously move and spread the fat evenly so it has the best chance at taking, and by taking means surviving, and it only survives if it's close to blood supply. So I try to fan it out or spread it out evenly without just dumping in one place. That's my technique. I use the ultrasound, so I'm also looking at what I'm doing with my own eyes, stuff that you cannot see, or we used to be able just to feel. Now we have the ultrasound that really helps. So I've seen it last. I've seen it that with the evolution of my technique, more retention of fat.
Awesome, thank you. All right, so we have Jada asking, what's the downtime on liposuction?
Same thing with the BBL. I think the difference between the liposuction and the BBL patient is that they're not worried about sleeping face down. They can sleep on their sides because the butt does not factor into the equation. So the liposuction patient still has to do the same amount of massages, has to wear the garment the same amount. It's just that they're a little bit more free to sit down the way they want to, sleep face down, face up, change, So I think it's just a little bit easier of a recovery if you're not incorporating a BBL.
Perfect. Thank you so much. Okay, so I want a mommy makeover, but I'm not sure what it includes.
Okay, a mommy makeover traditionally means a procedure on the breast and a tummy tuck. That's what a mommy makeover is. It's just straightforward. Don't confuse it with anything else. Now, what do I mean with a breast procedure? A breast procedure it's based on what your breast needs. So if the patient's breast is an augmentation and there's no droopage, then it's just an augmentation with a tummy tuck. If the patient needs a lift, then it's a lift with a tummy tuck. If the patient needs a breast reduction with a tummy tuck. If the patient needs volume and a lift, so it could be an implant with a lift and then a tummy tuck. And then recently we coined the term the Mommy Makeover Plus, where we are also talking about patients that are asking about intimate GYN area rejuvenation of the vagina and rejuvenation of the labia minora and majora. So and after researching that extensively, I have found that is a procedure that we can combine. So you can do a Mommy Makeover Plus, which includes a breast procedure, the tummy tuck, and the intimate area rejuvenation. Those, I think, combined together are safe, and that's what a Mommy Makeover is. And now I added the Mommy Makeover Plus just to explain to you guys what that means.
Yeah, that's awesome. So if you're looking into that procedure, definitely take advantage. All right. Gigi, is there anything we can do to help with the blood supply and retention, like a supplement?
Not really, not really. Look, if you come here with, you're not going to get here to the OR without having good, healthy lab values. We're going to make sure that everybody that gets on the OR schedule is pretty healthy and is going to recover well. What you can do is not sit on your butt, and then eat a well balanced diet. And we're talking about protein dense foods that will help you recover. There's no magic pill, it's nutrition. There was a bad term that's floating around and has been floating around for years: feed the fat. Okay, so if you're really taking a lot of Ensure and these high glucose supplements that usually are not very healthy, what you're going to end up doing is just gaining weight. Okay, and the fat that we transfer is not necessarily going to live or die because of your intake of high calories. Obviously, you're not going to starve yourself. You're not going to deprive yourself from food. You're going to have to find out what your caloric needs are, and you're going to increase them a little bit with protein-dense diet, so that because you're healing, you're going to be hypermetabolic. So you're going to have to go up in calories a little bit, and I would like them to be from protein. I don't want them to be from simple sugars, because then you're just going to gain weight. So I hope that helps. Again, if you have a nutritionist in the area, we can always interface with a nutritionist and discuss that with them. But please stay away from taking a lot of Ensure. And all that does is just puts you in such a caloric surplus that you're going to end up gaining weight in all the wrong places.
Very interesting. I never thought about that. Perfect. All right. Can you reshape BBLs?
Yes. So if you have a BBL done and you're not happy with your shape, obviously within reason, there's certain things that are stretched out beyond repair. But send me your pictures, and what we try to do, and I do that all the time. There's not one week that doesn't pass by where not every patient I get is a first-time BBL. I get a lot of patients that come to me for help, either because they went somewhere else and they did not know about me, or in the past they were looking at my profile, but they said I was too expensive. That's what I heard from a patient, and they come back for a second BBL. If you have an issue that I can help you with, yes, I will. What I noticed is a lot of cases, the lipo's not done well, so the patient doesn't really see their shape as much as they want, or the fat is transferred to areas that does not complement the body. And what I try to do is harmony. It's not about dumping, guys. It's not about just what's the easiest direction to put fat. It has to make you look good, and that's a struggle, because there are certain areas of the body, like the hip dips, that give us a hard time. And especially if your thighs are very flat and straight up and down, that's another stress on us as surgeons, because everybody wants the parentheses that flow nicely from the waist. So again, if you have an overly contoured, uneven butt, please send me the pictures, and I will try my best to see how we can help you. And I have experience where I've taken patients back to reduce the volume and reshape them.
Perfect. They're calling you the GOAT. You are the GOAT.
Thank you. Awesome. I appreciate it. I appreciate that confidence.
Very good. Okay. When can you go back to work out after a BBL?
Okay, so I want you to walk from the first evening. I want you up and walking as much as you can. The actual workout in the gym, which is, I'm assuming, what you're asking about, high intensity interval training, traditional weight training, I want you to wait for 3 months. Okay, your body's going through a lot of changes. What you really should focus on is walking, maybe doing some stretching exercises. Maybe you can use rubber bands, resistance training for your upper body, just to stay a little bit in tone. Walking, and focus on your diet, making sure that you really become an expert on your intake.
Perfect. Okay, so I see a lot of your patients in here saying amazing things about you, so that's great.
Thank you, everybody. I really appreciate the support. It's amazing.
Yes, thank you so much for joining. All right, so I got this question. it says, do I have to take my IUD out for any procedure?
No, no. Let us know what kind of IUD you have, because they're different to a certain extent. There's a small risk when they're not the IUDs that secrete hormones. Any type of hormone that's to prevent conception can increase slightly the risk of having a blood clot. But I do give everybody after surgery, when they come back to the first post-op visit, we start injecting them with Lovenox, which is a blood thinner, and we do 10 days. So just let us know what you're on, and we'll give you recommendations. I study every single medication list specifically to see what modifications I would suggest.
Awesome. Thank you so much. Do you specialize in skinny BBLs?
I specialize in all BBLs. So if you consider yourself a skinny BBL, please send me your pictures, and I will point out, and please don't get offended, I'll point out where the fat is that I would like to go after. Very, very rarely not found an area where we can remove fat that will enhance your shape. Even, like I said earlier in the conversation, in the live, unless you're a soccer player that's burning 10,000 calories a day, or you're a sprinter that's training for the Olympics, we can find fat. So I hope that answers your question. Send me your pictures, weight and height, and we'll give you feedback.
Perfect. Right, Queen Aliyah is asking, when do you see complete results after the BBL?
I see them on the table. I see them immediately, and that's why I like to take some pictures so that the patient can see them the next morning. As you get further and further out of surgery, in the first 12 hours, you do swell up. But there is not one single patient in my whole career that has not gone into tears when the faja comes off. When that garment comes off and they can actually see their body in the mirror, it's amazing. To me, the power of lipo is second to none. The fact that those love handles are gone, the fat around the abdomen is gone, this is very, very powerful, and it's amazing to see the reaction. I'm really impressed with lipo.
That's awesome.
Yeah.
All right, let's give a little bit of shout out here.
And
Yes.
then the one thing I forgot to say, and if you continue wearing the garment properly, the foams, and doing a lot of massages, including massaging yourself with your own two hands, and I show that to every patient, and my patients from the past will tell you that I actually stand up in the room, and I show patients how you can massage your whole front. You can even get all the way to your upper mid back and your love handles. So massaging yourself consistently, you'll start feeling your skin change gradually and become soft. And your love handles. So massaging yourself consistently, you'll start feeling your skin change gradually and become softer. I tell patients, you won't feel normal again 100% until at least a year is over.
Awesome. Okay, so I was saying a little shout out here to you. SS Steph says he's the best surgeon, hands down.
Thank you, Steph. I
Awesome.
appreciate the support.
All right, and then I saw a question there asking about the age requirement for a BBL.
There is no age limit, guys. It's health limits. So whatever whatever your health condition, please be honest. Tell me about your past medical history in detail, your past surgical history, any family history that might be significant, the list of medications, all your surgeries, and let us please sit down. I'll sit down and look at it and give you a risk stratification and make sure that you understand where you stand in the terms of risk. And I will not put you to sleep if I don't think that you're going to coast through this with flying colors.
Awesome. Okay, we have this question. Diana is asking, how many days do drains stay in?
If you're talking about the tummy tuck, the drains will stay in for at least 10 days. I base it on how much output the drain is putting out. And we sometimes take out one before the other, depending on which drain is putting out more fluid. We don't want to prematurely take them out too early, because then you get fluid buildup. And if you're out of town, people are not going to touch you, and you're going to end up with a seroma, collection of fluid under the skin. Now, when it comes to liposuction, with or without BBL, I stopped using drains a long time ago. Why? Because they bother the patient, they hurt. I found that fluid drains from around them, they're actually an obstruction. They get clots in them, and they don't function very well, and they get tangled. patients have had them come out prematurely, so I stay away from them. What I do is every time the patient comes in, I have the incision, I push on the incision, I push the fluid to the incision, and the fluid naturally comes out in that spontaneously. And that's why we want you guys, actually this is a point that I want to make. I want you guys to come to our clinic when you're in town. I'm hoping that you guys stay 7 days after surgery. I'm not counting the first day when we pre-op you. I'm not counting the day of surgery. So those 7 days, if you come here every day, we will work with you to teach you how to push fluid out. Okay? What happens is a lot of patients go to come and see us the first day and then they disappear because they're staying at a recovery house and they try to sell packages there, and patients are not having a proper lymphatic massage that's supervised by us here. And that's where things don't progress well. So if you come to Miami and you're already leaving home and leaving all the comforts and conveniences of home, okay, stay close to where we are. Stay close to our clinic. The clinic is surrounded by a lot of nice hotels. Bring a family member. If you can't, ask my coordinator, and she can give you the name of private duty nurses that can stay with you and help you. And then a lot of these hotels around us that I have no vested interest in are within walking distance. So you can save on the vehicle. You don't have to rent a car. There's a lot of restaurants around us. The airport is right next to us. So those conveniences that you think you're going to gain by going somewhere else and only just showing up one day for post-op puts you at a much bigger disadvantage than the patients that actually respect our instructions and come here 7 days in a row. They leave here so much better than the ones that just decide to do things on their own. Okay, a lot of that information is in the packet that you get immediately after you sign up, but ask my coordinator to give you advice. There's a few people that we like how they take care of our patients. We have no business relationship with them, but we've had experience over the years on how they take care of the patients, and we're very happy to refer you to them.
Perfect. So she actually asked, so we fly home with the drains and take them out here?
I try my best for the tummy tucks to see if we can take them out here. If we can't, because it's too premature, then we can have a nurse practitioner where you're at, or a PCP. Sometimes we've actually FaceTime with the patient and we just guided the patient on how to remove them. Okay? So we have years of experience on how to handle this.
Perfect. We have this question on Instagram. How long after postpartum can I come back and have surgery?
Okay. So your body goes through a lot of changes for 9 months. Okay? After 6 weeks, the inside, where the uterus and the vessels and all that stuff, after 6 weeks, you're pretty much back to your pre-pregnancy state. Okay? But I'm talking about your internal organs and your vasculature. But your skin takes a while for it to come back to normal. And if somebody's breastfeeding, which is important, the breast takes a while, and it's going to go through a lot of changes, because remember, the production of milk stretches the skin, and the skin might or might not shrink after you stop breastfeeding. So you got to give yourself time. I really think that you need a minimum of 6 months after a pregnancy for you to keep on allowing your body to change, and especially if you start working out, to see all that skin tighten up. So you want to give yourself at least 6 months of working out, eating better, taking care of yourself, and then send me your pictures and we'll see if you're ready.
Awesome. Thank you. So I know you... Sorry, go ahead.
No. I mean, I'm basing this on personal experience. I've had the privilege of seeing a lot of patients come in before they get pregnant and discuss this with me. I've seen them after their pregnancy, and I've seen the evolution of the skin, and especially if they breastfeed. So I've seen a breast where at one point, right after they stopped breastfeeding, I thought that the patient might need a breast lift with implant, and then they come back 6 months after that or a year after that, and all they do is need an augmentation. I'm not saying that that's going to be always the case. Some cases you have a few pregnancies and you lactate a few times and you breastfeed for 6 months, you might probably need a breast lift with an implant. A couple of pregnancies, stretch marks, skin damage, you might need a tummy tuck with or without a lipo. So but give yourself some time to heal. That's what I'm trying to say. Sorry to interrupt
No,
you.
no,
Go
no.
ahead.
Perfect. That's great. So I know you already touched on this a little bit, but we have another question. What is the highest BMI limit?
Okay, guys, the limit is not something that I like at all, but the number is 40 and below. So usually we try not to mess with the Department of Health, Board of Medicine. These are rules that are set for your safety. The American Society of Anesthesiology also has guidelines where on an outpatient surgery center, we don't want to go above that because of the stratification of risk, the increased risk. So that's the number, 40. Do I think it's fair? No, not really. Fat distribution is different from one patient to the other. Some patients hold their fat more centrally, some patients hold it more peripherally. So lumping everybody into one basket is not fair, but that's the rule, 40 and below.
Perfect. Okay, do we see you post-op doctor or just a nurse?
I'm very famous for being a helicopter doctor. How about that? Okay, I'm on top of my patients all the time. There are certain periods of the day where I can't be out of the OR because I'm doing a procedure, but between cases, my nurses do pull me out of the room to come and see my patients. Okay, and that's why some patients sometimes wait. And yes, but I try to see them as many times as I possibly can.
Awesome. All right. Dare is asking, do you do arms?
Arm lipo, yes. Arm lift, yes. So arm lipo, if you have good skin and it's not very loose, then you'll be a good candidate for just a lipo contouring, just like the rest of the body. I do that a lot. There's not 1 week that doesn't pass that we don't do chin, we don't do arms, inner thighs. So yes, I do. And if the skin has become very loose, it's a combination of lipo and removing of skin, and that's called a brachioplasty, where you have an incision on the inside of your arm, but on the where the bicep line into the armpit. Okay.
Okay, nice. Right. We have, how's the recovery from the arm lipo? Actually, speaking of.
Okay, the recovery from arm lipo, I've seen it where it's not really that bad. It's annoying when your arms are sore and you have to wear a garment. But you know what? It's the first couple of days that are just a little bit uncomfortable. But I think as the patient, respects our opinion and starts showing up more and more for their massages, and they're actively massaging themselves, because if one hand is massaging the other side, you see progression and healing much faster. It's always amazing to me how the human body heals very well. Your lymph nodes are in your armpits, so holding your arm up and massaging the fluid down towards the armpit. I do holes on top right there in the armpit crease and down by the elbow, and they stay open and you can drain them. So I think the first couple of days are the most annoying, and after that, again, if you stay around, we'll help you. We'll teach you how to deal with it.
Okay, perfect. Thank you so much. Guys, if you have any last minute questions, go ahead and ask right now. Just a last question here. If I have high cholesterol, is this a problem?
Not really, but I hope that you're having that situation fixed with your primary care physician, and you're taking some medication for it. But yeah.
So make sure
I
it's
have
controlled,
cholesterol.
right?
I have high cholesterol. Yeah,
Okay,
I
there
take
you go.
medication for it. I have hypertension. I take medication for it, and they're controlled. So that's a well-controlled medical condition does not prevent you from having surgery.
Perfect. All right. Well, thank you so much, Dr. Ghurani, for
You're
being
welcome.
on with us. Thank you guys as well for joining us. And any last questions? If you want to book your free consultation, where can they find you, Dr. Ghurani?
Okay, so you can find me on Ghurani MD on Instagram, in the clinic, Icon Cosmetic Center. Send us your name, your number, your email address, your preferred method of communication, the times that you're available. We like to evaluate you with pictures, if possible, with a complete health history. I'm sure you can DM the TikTok that's on right now, and you can DM my Instagram. I will get to it as soon as I get out of a procedure. I always check my stuff. Sometimes during the weekends it's not as often, but I try. And what happens is I'll forward that information to our sales coordinators that will give you a call and give you as much information as possible. And then once you book, that gets transferred over to the pre-op coordinator, and she's the one that becomes your liaison for the rest of your journey. And then when you come to the clinic, it's my post-op nurse. So there is a very controlled, very tight circle where the patient, it becomes a known entity. You're assigned a medical record number, and we will be able to look at all the communication that's there. So let's start the evaluation the right way. Send us a DM with your name, number, email address, phone number, and we will be sending you information and having somebody call you.
Awesome. Just real quick, I see NY a little bit frustrated because we missed her question.
Go ahead, NY.
But she was just asking about the prices. So go ahead. Yes. Send us.
Go ahead. Prices. We try to not make that the point of the lives. Okay. Again, I think it's easier if you send us your information along with pictures, because there is no cookie cutter for us here. I don't treat patients the same across the board. So our prices are very competitive. There has been recent changes. There are some specials. Please send us your name, your phone number, your email address, and we'll get somebody to talk to you. And then they will send me that information. I will review it personally. I look at every patient's medical history, and I look at your pictures, and I give my feedback.
Awesome. All right. Thank you guys so